Dieting has become a new normal these days. You all want to detox your body once in a while, isn't it? As weight loss depends on your calorie intake, different kinds of calorie-reduced diets such as a low-fat diet, low-carbohydrate diet, Mediterranean diet, a Nordic diet, etc. are all these emphasizing on a particular amount of macronutrients intake. Now it includes a lot of healthy foods like whole grains, fruits, vegetables, seafood, beans and even nuts. So now that we know all these types of diets, we must also know that they can be effective against certain health conditions. Now let's see how. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan and today I am going to discuss about the comparison between the Mediterranean diet versus a low-fat diet that may help patients with heart disease. In a recent study published in the JAMA network, scientists compared the effects of a Mediterranean diet with those of a low-fat diet on key biological processes linked to the heart health. Now, in the largest and the longest trial to evaluate a Mediterranean diet for secondary prevention of cardiovascular disease, the eating plan was somewhat superior to a low-fat diet. Now, conducted at a single center in Spain, the trial involved close to 1,002 patients with coronary heart disease, 82.5% of whom were men with an average age of around 59 years. The participants were randomly assigned to follow a Mediterranean diet or a low-fat diet intervention, and both the groups received continuous dietary support over the 7-year study period. The primary outcome was a composite of major cardiovascular events including myocardial infarction, revascularization, ischemic stroke, peripheral artery disease and even cardiovascular death. As reported in The Lancet, 17.3% of the participants in the Mediterranean diet group and 22.2% of those in the low-fat diet group experienced the primary endpoint. While among men, the primary endpoint occurred in 16.2% of those assigned to the Mediterranean diet group and 22.8% of those assigned to the low-fat diet. However, the researchers found no difference in the outcomes between the diets for the women in this study. Hence, the authors highlighted the fact that Mediterranean diet did help the heart patients. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.